Thank you for joining us here today, and welcome to our webinar where we will talk about COVID-19 and the safety protocols that LeaderDog is taking. My name is Leslie Hoskins. I am a certified orientation and mobility specialist, as well as the outreach services and community engagement manager. This is the 6th webinar we have hosted to allow you to learn more about the programs and services we offer to empower people who are blind or visually impaired with lifelong skills for safe and independent daily travel. This webinar is being recorded and will be available on our website within a week. For those people joining us via phone, if you have any questions after the webinar, please call 888-777-5332 and ask to speak with a client services representative. Our client service representatives are available Monday through Friday from 8:30 to 5 p.m. Eastern Standard Time. For those people joining us online, you may enter questions at any time using the chat bubble in the middle of the taskbar found at the bottom of your screen, or you can use Control-T for a keyboard shortcut into the chat room. Once in the chat, you will find that we've posted a few more keyboard shortcuts. On the screen here, you will see a picture of an O&M client walking with his O&M instructor, keeping social distance and following behind him. Both the client and the instructor are wearing masks. Our presentation will take about 15 minutes, followed by 15 minutes for questions and answers. If we have a lot of questions, we can stretch a little bit longer. I'd like to introduce today's presenters. Our first is David Laughlin. David has 21 years of experience in guide dog training. His career started with Guide Dogs for the Blind in the United Kingdom, where he was a guide dog mobility instructor for 7 years before becoming their service delivery manager. Since 2014, David has been LeaderDog's Director of Programs, overseeing the training department. Among David's responsibilities is ensuring that all programs meet International Guide Dog Federation standards and that the needs of all clients are being met. David is a member of the Assistance Dogs International Candidate Review Committee and a Membership Review Committee. Our second presenter today is Erica Erke. Erica is a certified orientation and mobility specialist and our manager of extended services. She oversees our orientation and mobility training and our summer experience camp. Erica is currently the co-chair and member of the ACV REP O&M Subject Matter Expert Committee and a past president of Michigan AER. She has presented at several international conferences on the topics of guide dog readiness, alternative models in O&M, and accessible GPS. On the screen are separate headshots of David, Erica, and myself. I'm going to hand it over to David.
Well, good afternoon, everybody. It's great to be back serving clients, and I want to talk a little bit about the classes that we've been able to do here at LeaderDog. And I'm going to describe the photo that's going to pop up on the screen here. So there are 5 guide dog mobility instructors who are all jumping for joy, which was at the end of our first guide dog class, all wearing masks, as well as 1 certified orientation and mobility specialist who is crouching down. So our first class in July was much smaller than our typical classes that we have traditionally been able to do here at LeaderDogs for the Blind. We had 6 guide dog clients in-house, as well as 2 orientation and mobility clients. During that first class, we also did 4 in-home deliveries with guide dog and actually 8 in-home orientation and mobility trainings as well. Our residence is a 30-room residence, so to give you an idea of some of the adaptations that we've made, we now will have a maximum of 15 people in for training at any one time. So our first class was well under that 50% of the residence capacity. Our second class just completed this Saturday, actually. We were able to offer to clients from out of state or with a driving distance. So for our first class, we actually had clients who were able to be driven to LeaderDog. And our second classes for both guide dog and orientation mobility, we extended to various states throughout the United States. Unfortunately, we're not able to train anybody internationally at this point, but we continue to observe international travel guidelines. For clients awaiting training or going through the application process who have chosen perhaps not to come or not ready to come in for training at this point or to be served in home, we want to let you know that's absolutely okay and will not impact your application at all. And actually with some clients, we've chosen a different training model that they may well be more comfortable with. So guidelines, we've followed all recommended state and CDC guidelines. The picture on the presentation is a guide dog mobility instructor from the first class along with a client, both wearing masks, undertaking first walks with the new dog on the practice course. And the guide dog mobility instructor is stood behind but attached to the dog by a long leash. So for their residents, we have limited access to buildings and campus, and so only approved team members are able to come into the residence. Clients are more than welcome to go off property should they wish to do so, but we're unable to have visitors onto campus at this time, just to ensure that we keep everybody as safe as possible. We continue to follow social distancing guidelines wherever possible, encourage hand washing as often as people can, and masks are provided both to staff and clients and required in shared spaces within 6 feet of working together, which is required at certain times during training. There are also sanitization stations throughout the residence, as well as individual bottles for both clients and team members. And with that, I shall hand you over to Erica to talk a little bit more about our daily screening process.
So in addition to the guidelines that David just mentioned, we require team members and clients to participate in a daily health screening before any contact takes place. On campus, team members complete the survey before coming to work, and our resident assistants contact clients before they leave their residence room each day. If clients are being served by a home delivery, team members complete the survey before they leave home and begin work, and then they additionally call the client to complete the survey before any instruction takes place and before the instructor arrives to begin instruction. Our survey includes 2 questions as follows. Do any of the following statements apply to you? I have a fever of 100.4 degrees or higher. I am experiencing shortness of breath. I have a cough, excluding chronic cough due to known medical reason other than COVID-19. I have at least 2 of the following symptoms: chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell, and or diarrhea or extreme fatigue. I have had close contact with a confirmed probable COVID-19 case in the last 14 days. The screen includes a display of this health screening that our team members do electronically every single day. I'm going to now turn it back over to David with some modifications we've made around campus.
Thank you, Erica. So for our residents, our dining room, so on the screen right now, there's 2 photos of our old dining room as well as the banquet room. So as we have a maximum or up to 10 people in each room, we've been able to spread out both clients and GDMIs and orientation mobility specialists who have lunch whilst clients are training across both of those rooms. So maximum of 10 people. And for some background, each room, so the dining room probably traditionally would hold about 30 people, and the front half of the banquet room would probably hold 50. So just to give you an idea of how much we've been able to space everybody out. For clients who wish to have lunch served to their room, that is also an option for people who feel more comfortable doing that. So throughout the residence, we've been able to spread seating out in all common areas so that people have been able to socialize to some degree. We still just require masks in those common areas. But we've still been able to undertake some socially distanced fun activities as well throughout the last couple of classes. So our pizza night, bingo, trivia, and I know there's been a few other activities that our clients have enjoyed during their stay here with us. For transportation, so this is for transport to and from training areas for both guide dog and orientation mobility. We're very fortunate that at Leader Dog we have a vast fleet and we've been able to bring more vehicles into training. So on screen is one of our class buses that would hold about 12 clients in there, and so there are no more than 4 people on a vehicle like that, which would be 2 instructors potentially and 2 clients. We have some caravans, and again there would be up to 3 people when you would normally be able to seat probably around about 6. So we've been able again to spread people out to be able to transport to training areas. We've also enhanced our sanitization plan as well. So vehicles are cleaned and sanitized on a regular basis, on a daily basis as well. Just to talk a little bit more about social distancing where possible, or rather perhaps where not as easily possible, particularly early training for both guide dog and orientation and mobility. There are times when instructor and client will likely be within that 6-foot radius. So we've been able to adapt our equipment as well. So we've developed a longer Juno handle and some various other options for that. So for Juno, for those that aren't aware what Juno is, that is when a guide dog mobility instructor plays the part of the dog prior to the client actually receiving their dog. So it enables our client to learn all of the ins and outs of handling the dog in terms of guide work, use of verbal, how to give physical praise, how to treat, also foot positions, what cues, what verbal cues to use prior to then the dog being in hand. So we're able to adapt the equipment for that, as well as for clients who may require some human guide. A folded cane, again, just increases the distance between the person giving the sighted guide and the person receiving it. However, where possible, we're going to use verbal instruction in the first instance, of which I will hand you over to Erica to give information on that.
Verbal instructions are always our first line of instruction. However, many times instructors do find themselves intervening with hand over hand or hand under hand support to be able to show something in a quicker manner. In current times, we're making a much greater effort to stick with verbal instruction and avoid contact if at all possible. So environmental and direction descriptions generally are given for lessons and route instructions. We've always done that verbally or provided it in a preferred format for the client. GDMIs and our certified orientation and mobility instructors have been using a voice amplifier to aid in communication, as it can be difficult to speak and or difficult to understand someone when they're speaking through a mask. So that voice amplifier makes it much more easy for the instructor to speak without having to raise their voice. Makes it also much easier for the client to understand the instructor without the muffle of the mask, or through the muffle of the mask, I should say. We encourage clients to advocate always for clarification, but it's much more important than ever now that we convey and help to convey what each other is trying to understand or be understood. On the screen is one of our guide dog mobility instructors. all suited up and ready to go with her mask, and she has the voice amplifier worn, which is kind of like a boom mic that has, as our guide dog mobility instructors would describe it, a Britney Spears mic that she's wearing right in front of her mouth. And then the pack that is the speaker is worn on her hip, or she's wearing it on her crossbody first aid pack. Next, we're going to talk about some client testimonials. So overall, we've found great success in our return to client instruction during these current times. One shining example of this comes from one of our orientation and mobility clients, Dave from Pennsylvania. He shared with us, "This is the first O&M training I've ever had. This week I learned that I am unstoppable now, that I can go anywhere and I can be confident." So while we've had to wear masks and take into account some new safety protocols for his training, and while he did as well, his instructor used some different strategies. I think that this quote shows that our clients aren't just focused on the pandemic, they're focused on learning and continuing to tackle their goals. In the picture or on the screen is a picture of Dave traveling during his training with us at Leader Dog, and he is masked up in a rural environment.
All right, so we'll now move on to questions and answers. Again, for those joining us by phone, please direct your questions to our Client Services Department at 888-777-5332. For those online, feel free to type your questions into the chat bubble. And so far, our only question has been, will this be recorded? And the answer is yes, it is being recorded and will be available on our website within a week. So feel free to send in any questions. We'll give it a second.
Well, I would be happy to share while we are waiting to have questions come on board that some of you may know that Rod Hainline, our former Chief Programs and Services Officer, has retired at the end of June. And as he transitions further into retirement, he is working with us on our orientation and mobility team and is helping us to meet our goals for serving clients. And we very much enjoy having Rod on the O&M team, and he's enjoying getting back to teaching on a more regular basis.
One of the questions we had is, where do you purchase these boom mics?
Ah, great question. So, so we actually found them on Amazon. There's a good number of options out there. I think the ones we got were about something like $38, $40, something like that. So they weren't terribly expensive. And I will say that the instruction has been very clear, very easy to understand. Yeah, so on Amazon, if you search for, let me think, I can't think. I'll come back to you.
Geisy, G-I-E-C-Y or G-E-I-C-Y voice amplifier.
Voice amplifier, yeah. So if you put just voice amplifier into Amazon, then you're going to come up with different options.
When we post this webinar on our blog, on our website, we'll make sure to include a link to the device that we purchased.
What is the average wait time to be matched with a guide dog?
So right now, it's a little tricky to say. It'll depend on a few factors. I would say on average, anywhere between 3 to 6 months. Right now, that would depend also on whether we're able to serve from that particular state, which we're hoping to open up to more states as things start to, or hopefully continue to improve. So yes, I would say on average 3 to 6 months. Depends on if you have a specific breed, or would prefer male or female, or a black lab, or a yellow Labrador, those things, or a golden retriever. Those requests can extend the wait time, just depending on which dogs are coming through the system and the best possible match for you. But yeah, 3 to 6 months, I would say, is average.
Okay. And are we serving clients in-home or just on campus?
So we're serving clients both in-home and on campus. So again, through our admissions committee, who will look at all of the applications and generally decide and work with the client on what the best possible option for service delivery is. We are doing both services currently.
And in your vehicles, are you using barriers between clients and drivers?
So the barriers that we're using are the masks. We don't have any other types of barriers. So we also do have, however, the face shields for anybody who would prefer, as well as the mask, to use a face shield as well.
And are all of the dogs back on campus or are they still out in other foster homes?
It's a great question. So yeah, so they were out in foster homes for a period of time when we were unfortunately unable to serve any clients. However, they are all, the dogs that are due back in for training are all now on campus.
And should I be worried about my leader dog getting COVID?
So again, we'll actually put on, when this goes out, our statement from the vet, so they're far better to actually explain this. There really hasn't been any real evidence that there are, that it's transferable. I know there's been a case or two across the world, but I don't know the ins and outs of that, so I would say no, but we will put our vet statement around that subject when we post this as well.
Any use of an N95 mask without the breathing valve for any clients who have demonstrated a need for closer personal training?
Can you say that
Yeah.
one more time?
Any use of an N95 mask without the breathing valve for clients who basically need or have demonstrated a need for closer personal training. So for those that you can't keep that 6-foot distance, have we thought about any of the other like medical masks?
So right now, due to the executive order in Michigan, N95 masks are required to be given to
Medical professionals.
yeah, thank you, medical professionals and such. So we aren't able to store any here in terms for clients or staff.
How is our O&M program addressing street crossings yet? I think maybe in the sense of like the social distancing again, when out analyzing an intersection and making sure that we're keeping distance, but still close enough to protect our clients.
So we're addressing that in the exact same manner that we were previously. We are trying to very much more so make sure that instruction and understanding is clear before any street crossings are initiated. If contact does need to happen or closer proximity does need to happen, then it does, just as it would in any other training situation. That's why our instructors are always and our clients are always armed with masks and have them on if there is any situation where we will be entering that 6-foot close or closer proximity. In fact, many of our instructors continue to wear masks at all times, even when much more distance is given, just for everybody's safety.
Do we also have our clients wear an amplifier device?
We haven't, and we haven't had the need to, but it's something we have discussed, and if we did, then we would certainly look to do that, yeah.
How often are we going out in stores and in public during our guide dog training?
So we've adapted that. We haven't been, again, I'll just take a step back. So it's still, that would come down to client comfortability, is that the right word? Comfort. Whether the client wants to even do that type of training. So for example, we have Maya just down the street here, and we will go in the vehicle, complete the training around the store, come back out and return back to campus. Whereas traditionally we may have found a seat within that facility and waited until all clients went around. So we will complete some of that training at certain times of the day when it's going to be quieter, in certain environments where we're able to achieve the objectives that we want to achieve. But again, if the client is comfortable to do that. If not, and when the time is appropriate, that's something we could certainly cover at home, post-training with a field rep, for example, should there be something specific that a client needs to do.
Yeah. All right. I think that wraps it up here. We're going to go ahead and stop here. If you'd like to learn more about our programs and services, please visit our website at leaderdog.org or call us at 888-777-5332 or email us at clientservices@leaderdog.org. Any blind rehab professionals with questions, feel free to contact myself, Leslie Hoskins, at leslie.hoskins@leaderdog.org. Thank you so much for joining us today, and I'll leave you with one final reminder that all Leader Dog services are free. Have a great day.